Patients with multiple long-term conditions, also commonly called MLTCs, are more likely to be admitted to hospital or die during the winter period. To better understand which long-term conditions are most likely to lead to patients being hospitalised or dying during the winter, researchers at the University of Southampton reviewed patient data for nearly 50 million people and hospitalisation and death records from the 1st of December 2021 through to the 31st of March 2022. 31 out of every 100 records the team reviewed, which included data from 15 million people overall, were related to a patient diagnosed with MLTCs. Researchers then used a measurement known as person years, which adds the amount of time a certain number of people are studied to measure a longer time frame. They then looked at the number of hospitalizations and deaths that would happen every 1,000 years. In this study, patients with no MLTCs were hospitalised at a rate of 96 hospitalisations for every 1,000 person years reviewed. Patients with some combination of cancer, chronic kidney disease, cardiovascular disease and diabetes experienced 1,643 hospitalisations for every 1,000 person years, and those with a combination of cancer, kidney disease, cardiovascular disease and osteoarthritis experienced 1,552. Patients with cancer, kidney disease, cardiovascular disease and dementia were also more likely to die during the winter months at a rate of 345 for every 1,000 person years, compared to just one death among patients with no MLTCs. Because patients with these specific disease combinations face the greatest risk of hospitalisation or death during the winter, action is urgently needed to help them manage the challenges of those months.